Tonight, people across Connecticut still headed to the hospital with the flu. Those hospitals are now taking steps to keep their staff and their patients from getting sick. News 8's Bob Wilson is live tonight at Hartford Hospital with what's being done. Bob.
Yeah, you know what? They are really gearing up as that flu continues to ramp up. We've been telling you about this all week, all month. It's a bad flu season. It's only getting worse. And now the numbers are out, and healthcare workers are taking it to the next level.
Today we had 26 people in the house. As of noontime last Friday, we had 20.
About 15 new people a day are hospitalized at Hartford Hospital for the flu. At the peak, 42 people had been admitted with serious or critical symptoms.
We're going to see this type of volume probably for the next 2 to 4 weeks.
Before you're even admitted to the ER or even see a doctor, the first thing that happens as you walk through the door, they ask you a series of questions to determine your infection level.
So what we generally do right at triage, right at the entry points to our clinics or the ED, if somebody's coughing, they got flu symptoms, they're going to put a mask on them and just separate them from somebody else. They'll then put them in a room.
Well, right now we're in what's called a negative pressure room. It's actually got gauges on it right here, and a system that draws the air up into the room and away through HEPA filters. However, that's not really necessary for the flu. That's more measles and tuberculosis. For the flu, they can even put 2 people in a room. They can draw the curtain. That's because the flu's main transmission is through water droplets.
They'll then put them in a room, put a mask up that says droplet precautions, and anybody who goes in that room is going to put a little small surgical mask on.
They're also thinking about extreme precautions that have only been enacted twice in the last 15 years. Not allowing visitors inside the hospital.
It's generally something we'd prefer right up front to just put the signs up, try to get people to stop if they've been sick.
Interestingly, Dr. Ross says if you have the virus and you touch a doorknob, the virus can live outside the body for up to 12 hours on metal and plastic surfaces. I'm Bob Wilson reporting live at Hartford Hospital in Hartford. News 8.
All right, Bob, thanks. Schools across the state also taking steps to try to limit the spread of the flu. Albertus Magnus College is posting flyers with flu prevention tips. They're also handing out stay healthy packets, putting hand sanitizer dispensers up on walls too, and cleaning a lot. The University of New Haven doing some of those same things too. 6 students are asked to contact Human Services online so they don't go in and make other students sick. Health Services checking up with them every day and notifying professors. Schools also handing out packets with face masks, Tylenol, and Motrin.